We are here at the Festival of HealthTech and we have with us Mr. Nakul Pasricha. Thank you for joining us, Mr. Pasricha. Uh, what I want to understand from you is uh, in the pharmaceutical industry of India and the medicines that we are the generic medicine producers with the pharmacy of the world, and but when we talk about the medicines which are selling inside India, regulatory is often flag that there are a lot of substandards medicines, there are a lot of counterfeiting also happening. Your firm works around these solutions. So, what are the solutions that you think will work for India?
So first of all, the problem of spurious and substandard medicines is something that has been flagged by the WHO as well as by Indian regulators as something that they really want to tackle. They have done surveys, international agencies have done surveys and realized that it is a problem and it is something for which solutions are desperately needed in order to protect not just the health of patients but also the reputation of the very important pharmaceutical industry in India. Now, in terms of what the problem is, there are two kinds. One is the substandard medicines, which is, for example, you may be familiar with the issues of contaminated cough syrups that cause some deaths, unfortunately, outside India. That is a problem of substandard medicines where it is adulterated, it may have poisonous substances, or it may not have enough effective ingredients. The other problem is of spurious, of you could say counterfeit or fake medicines, which are absolutely not going to work, and they could actually be just poison or some fly-by-night operator trying to fool the public and gain massive profits. Now, in order to tackle this problem, I feel we need three aspects. The first is there needs to be awareness that it is a problem to begin with. Awareness not just by the regulators, but awareness by you and I and the patients and the consumers. The second aspect of it is strong regulations that not just from the substandard side test the quality of medicines, but also introduce authentication or traceability solutions into the ecosystem. And a good example of that is the QR coding regulation that the regulators have brought out in India for the top 300 medicines. From August 1st, 2023, the top 300 medicines by volume, by sales in India have to have QR codes that anyone can scan with their mobile phone and be able to check that this is authentic, as well as get information about the product that may help them in terms of ensuring it's not expired, or in terms of how to report any issue that may arise. And I think more such steps are needed in order to kind of tackle this.
Right, but these QR codes, can they also not be fake?
So the thing with the QR codes is that each QR code on each individual pack, each individual strip will have a completely unique, random, kind of guessable, if you could put it this way, code, which can also be encrypted and kept really secure. So what a counterfeiter would have to do is take, let's say, a batch of 1 lakh strips and maybe try to guess randomly codes, which first of all is very, very difficult to do. Secondly, even if they try to do that, this is backed typically in most systems by a digital kind of intelligent response, or even AI-powered system that can immediately say, no, these codes have been coming to the system multiple times, so it is a counterfeiter trying to crack the system. Since it is a mobile phone, it can even give the GPS data, and it can give kind of intelligent data to drug controllers and to the companies to be able to kind of detect if there is such an anomaly happening. So this kind of solution has actually been implemented around the world. Barcoding or serialization and traceability, as it's called, to protect the pharmaceutical supply chains. In fact, India has had this kind of solution mandated for exports since 2011. And I'm very, very happy to see that finally in the domestic market, we are implementing such a solution in 2023.
Well, it has taken some time, 12 years that we are now par with the western part of the countries where we are exporting these products. But at the same time, regulating challenges are also there. Regulation challenges also there in the country. As per you, what are those challenges?
Yeah, absolutely. So, this is something that when you speak to drug regulators, they will all tell you we are a massive country. I think we all know what the population is, what the number of kind of pharmacies is. I think various estimates, 6 to 7 lakh kind of chemist stores that are dispensing medicines. There are multiple hubs where medicines are distributed and, kind of resold. And the kind of it becomes very, very difficult for drug regulators with their limited resources sometimes to be able to go and actually nab all these instances of counterfeiting. I think they need support. I think that is something that obviously the government, I'm sure, is working on to give them the right resources in terms of human resources, in terms of any financial support additional that they may need. Second is we need technology in order to support that. And third, I think we need strict penalties. There needs to be very stringent penalties for drug, counterfeiting or producing substandard or spurious medicines, where it let us say puts the fear of God in anyone trying to do it, because you're playing with a human being, a patient's life, and I think. If we tackle all these challenges, if we implement technologies, if we have strong regulations, and if we have the tools for the enforcement officials to actually do the enforcement actions, I am sure we can address this issue.
Right, right. Recently, in the Jan Vishwas bill, there were some penalties which were stripped away, and they were made into fines. So I don't know whether we are going towards regulation or deregulation at this point in time. That is something very debatable. Also, you spoke about the 300 medicines by volume. Is this a pilot happening at this point in time that we'll see after a while that this will be implemented to more medicines?
Yeah, so that's a great question actually, and the government has been thinking about this for years. It's come in 2023, but from 2015 onwards, there was first a draft. Then the Drug Technical Advisory Board made a recommendation a few years ago, which was it took a while for, let us say, for it to get implemented. And the challenge was that, as you know, we have a long tail of pharma manufacturers in India, some very kind of small scale units that are essential to kind of the pharma ecosystem, but they kind of protested that the cost of implementing this is very high, and so they did not want the government to mandate this for them to implement it. So I actually think the government did something quite smart. But the government said, okay, let us only look at the top 300 brands by sales, right? These are all high-selling brands. These are mostly large companies that have the resources, and in many cases may already have implemented something like this for the exports that they may be doing. And this covers, I believe, about 30 to 35% of all the medicines sold in the country. So they said, let's start with that. And then I am quite sure, and in fact I've seen in conferences and different drug regulators also talking about it, where I'm quite sure it will be expanded in the coming years. This is a way to say, okay, let's stop kind of debating this, let's actually implement it, and then we'll expand it from there. And they've implemented it. I'm very happy that unlike some other regulations that I've seen, which have gotten delayed over time, this one was not delayed. They went through with it on August 1st, and medicines have already hit the market. So I hope that it is a first step after a long time, which will lead to many more steps.
What is PharmaSecure at this point in time doing towards protection of medicines with the help of technology?
Yeah, so what we do is we help companies implement this and other regulations, and we help them kind of protect the safety of patients through these kinds of digital tools like the serialization, track and trace, traceability of medicines. And so we are deeply helping some of the largest companies in India implement this QR coding regulation, and we've actually to date, and for domestic now. We've been doing it for exports, but now that the QR coding regulation has come into force August 1st, we have been helping companies do that also now. So we have actually implemented more than 550 manufacturing lines across more than 100 manufacturing facilities across India, and coded more than 6 billion products with our kind of unique solution. So we feel that we have actually made quite an impact in terms of the number of medicines that patients have have been able to kind of verify for themselves, because of this. And as you said, it is one of the things where I feel we have mostly, largely, but not exclusively, obviously, been protecting the health of patients outside India. And now, at a very large scale, we are going to be doing that for India. So it is especially proud as an Indian that to be really implementing this at scale within the country.
A lot of work coming onto your plate soon. Thank you so much for joining us
My
here.
pleasure.
Lovely having you here.
Thank you.
Thank you.